Hi Bowen, and a very good evening to all our viewers here on TV1. I'm Dr. Dilshan Fernando, and this is your weekly dose of wellness here on Healthline. These days, we are facing the biggest challenge that global healthcare has faced for the past century, and of course, that's none other than the pandemic of COVID-19. And with the inception of the Omicron variant, we see a rapid spread and the numbers are rising. So, today we are going to be talking about COVID-19 infection, but about a specific group of very important people that might get it and are more prone to get it. Today we are going to be talking about COVID-19 during pregnancy. For this purpose, we have invited Dr. Achintha Dissanayake. He is a consultant obstetrician and a gynecologist. Very good evening to you, sir, and thank you so much for joining us here on Healthline.
Good evening, Dilshan. Thanks for inviting for Healthline.
So, first and foremost, to get into the topic, sir, now we saw when the Delta variant was spreading, many pregnant women were affected. There were some maternal deaths. So, what is the situation now? Are the numbers increasing with regards to pregnant women? Have there been any very adverse outcomes with this Omicron variant?
Yeah, so at the moment, the situation is that the Omicron variant, as you correctly said, is spreading fast in the country. And in the hospital setting, we are seeing increased number of admissions of COVID-19 affected pregnant women getting admitted to wards. On a daily basis, there will be 2 or 3 patients coming with symptoms, as well as few patients who might be completely asymptomatic and are incidentally found to be having COVID-19 are also getting admitted. Of course, compared to the Delta variant, we are not seeing that much severe cases, but of course the numbers are increasing.
Now, we see certain lay people and even some doctors comparing this new Omicron variant as a common cold like disease. But when it comes to pregnant women, can we just put it down to a very simple disease and just ignore it and just go about our day-to-day lifestyle? Or has it come down to that? Has the effects reduced down to that? What's your opinion?
Yeah, so if I just elaborate on bit on that answer, basically pregnant women are considered as a vulnerable group because pregnancy is a unique kind of period where there are lots of changes happening in almost all the body systems. These are just to adapt for the pregnancy. But when they do get an infection, it is well proven and it's evidence based that they tend to fare badly. And especially with COVID, it is known that when the pregnant women get COVID, they tend to have more severe disease and worse outcomes compared to a non-pregnant woman getting COVID. Again, based on the variants which we saw from time to time. So currently, Sri Lanka is almost in the 4th wave of the pandemic, and when this whole thing started way back like 2 years down the line, we have learned so much about COVID-19 infection and how it affects pregnancy. At the start, we didn't know how it's going to affect the pregnant women. Initially, of course, the first few waves mainly were due to alpha variant and beta variant, and though there, of course, most of the pregnant women were asymptomatic or had mild symptoms. But we all saw that with the Delta variant, there was a sudden surge, as well as lots of pregnant women got very badly ill. So the Omicron variant also we shouldn't take lightly. I mean, although initial studies have shown that severity wise it might be less, but what is more important is that the transmission is much higher. So just for a comparison sake, so for instance, if the Delta would affect 100 pregnant women and only 5 or 10 would get worse, Omicron will instead affect, let's say, 1,000 women, and of course of that 1,000 women, even though the severity would be less, still 10 women will get bad. So we should not take it lightly.
Definitely. Now, even though some mainstream media and social media compares the Omicron variant of COVID-19 to the common cold, especially when it comes to pregnant women, it's a precious period in your time. You're carrying another life inside you, and definitely you should take all the necessary precautions, get advice from your obstetrician as to what needs to be done if you suspect that you have gotten the COVID-19 infection, and always be careful. Now, moving on with our discussion, sir, now we have seen certain categories of patients are more vulnerable to get this infections? If you are immune compromised, or if you are having a cancer, so on and so, if you are undergoing chemotherapy, what is it? What is the situation when it comes to pregnant women? Are they more vulnerable to get COVID-19 as opposed to a normal lady? Is that so?
Yes, in a way, yes, because during pregnancy, the immunity level goes down a little bit. That is to adapt to the pregnancy. Again, pregnant women are well known to be vulnerable for infections like influenza, etc., and including COVID as well. But what we have known from evidence is that the pregnant women are more or less similar to contract the disease compared to non-pregnant women. It's more or less the same, but the problem lies in the fact that pregnant women tend to get more severe disease compared to a non-pregnant woman. Again, just to briefly explain about the physiology or the normal things which will happen in a pregnant woman, mainly because of the hormone progesterone, the airway tends to dilate, and this helps for the lungs to get ventilated better during pregnancy. But at the same time, especially towards the latter half of the pregnancy, when you come to the second trimester and the third trimester, that means the last few months of the pregnancy, the fetus is growing inside the tummy and inside the womb, and the womb enlarges, pushing upwards into the abdomen. So it exerts a little bit of pressure effect on the diaphragm, which separates the abdomen from the chest, which occupies the lungs. So there's a little bit of pressure effect on the lungs. So especially we see that pregnant women who are in their second and third trimesters, because of this pressure effect, if they do go on to develop pneumonia, then they tend to fare a little bit more badly because their lungs are already being compromised.
Yeah. So now, with regards to COVID-19, now like you said, the pregnancy is divided into 3 trimesters or 3 parts of 3 months each. So first trimester, second and third. Now, if a pregnant woman gets this COVID-19 at any part of their pregnancy, what sort of complications can be expected? Now, people think it might lead to a miscarriage, or pregnancy itself has so many other complications like increased blood pressure or increased blood sugars. So, does this infection of COVID-19 lead to any of those complications?
Yeah, I think it's a very good question. So, as I said, when we started with COVID-19, we didn't know how it's going to affect pregnant women. But 2 years down the line, I think we have got more information and we've got more evidence to scientific evidence to back what actually COVID-19 does. So, I'll just categorize the answer into 2 parts. So, COVID-19 can affect the mother as well as the baby. So, first, if we consider the mother, majority will have mild symptoms and also might be completely asymptomatic. So roughly about 75 to 80%, it will pass on like a flu, but that is of course if they are vaccinated and if they don't have other comorbidities. But there will be few women who tend to develop very severe disease and especially go on to develop COVID pneumonia. And if they do develop COVID pneumonia, then they tend to have more complications. And one complication would be difficulty in breathing, and that can cause what we call in medical terms adult respiratory distress syndrome. And also women during pregnancy itself increases the risk of developing clots. Which we call thrombosis, and these clots can happen in the legs, and also it's more serious if it goes into the lungs. So despite the pregnancy, on top of that, if they get COVID-19 infection, that itself increases the risk of getting clots in the legs as well as the lungs, which is serious. The other aspect of course is that when you have severe COVID-19 infection, especially in pregnant women, they are more prone to have these difficulties in breathing and pneumonia. But another important aspect that we don't that much consider, or we have to like show special attention, is the mental health, because most of the women are isolated during that period, and pregnancy itself they might have certain anxieties, and also they have mood changes, and also they might be worried about the baby, what's going to happen with the baby. And on top of that, if they get COVID, their usual support systems are not accessible, and they tend to think more about the infection. And so we have seen that mental health issues are also more with COVID-19 in pregnant women. Apart from that, again, there's long COVID syndrome, which happens after recovery, so that can also increase. So all these are things that can affect the mother. Now, if we move on to the baby, The things that we know that will cause, initial reports showed that there was no increase in stillbirths, but now we know that the stillbirth risk is kind of increased by twofolds when there is COVID in pregnancy. However, the overall rates of stillbirths are still low, but when you have COVID-19 in pregnancy, the risk of stillbirth is increased. Another thing is, of course, preterm birth. That means if a baby is delivered less than 37 weeks, we call it a preterm birth, and the baby can have problems because of this prematurity, which can have lifelong consequences. And we know that when there is COVID-19 in pregnancy, the risk of prematurity and preterm delivery is increased by 2 to 3 folds. COVID-19 may be associated with a little bit of increased risk of having a small baby, but again the evidence is kind of mixed for that. Then the other aspects are, of course, vertical transmission of the infection to the baby, and of course the neonate, or as soon as the baby is born, especially if the mother gets the infection close to delivery, sometimes the baby can get the infection. In our experience, of course, in the first few waves, we didn't see the babies getting COVID infection, but with the Delta variant, we saw more babies getting affected. Now we know that Omicron is more transmissible. That means it can easily transmit from one person to another. So then we can assume that the babies might also get more affected. We do know that COVID-19 does not cause birth defects or congenital anomalies, and also the miscarriage risk is not proven to be increased as well.
Now, definitely, if you were listening closely to Dr. Achintha Dilshan, even though some people compare Omicron to the common cold, it can cause so many severe complications with regards to your pregnancy. So, always being careful, taking the precautions is always pertinent. Now, if a lady or a woman in her fertile period is planning to become pregnant and they are planning to conceive, what sort of precautions should they take with regards to being careful from getting COVID-19? Is there something additional to what the normal people are being told to do?
Yeah, I think it's more or less the same. So they should practice social hygiene techniques like like social distancing, and also wearing face masks. That's to avoid from getting infection, washing hands and all that which we always kind of repeatedly let to know. But in addition to that, of course, very important is that if you are in the childbearing age, it's very important that you get your vaccines, because when you get the vaccines, you will have a certain degree of protection. It won't completely reduce your risk of getting the infection, but it will reduce your having a severe disease. So it's very important they get vaccinated as well, because we have shifted the vaccination into the childbearing age groups. So basically it's very important they get the vaccination as well.
Since you brought up the topic of vaccinations, now we have seen a certain hesitancy in certain people in Sri Lanka to get this third booster dose, and some people are attributing certain side effects with getting the booster. Some say they get certain numbness, some visual impairment, which has not been proven as yet. When it comes to pregnant women, what is your recommendation if they are pregnant or if they are planning to conceive? For ladies of childbearing age, what is your recommendation with regards to vaccine?
Yeah, so my recommendation would be simply to get the vaccine at the earliest chance that you get, as well as if you have completed your second vaccination dose, and if you are 3 months from your second dose, then you are eligible to receive the booster dose as well. And the booster dose also you can get irrespective of which period of the pregnancy you are in. So even in the first trimester, second trimester or third trimester. Now as you said, lots of people are hesitant, and I think what we use is actually in Sri Lanka. So as you are aware, the Sri Lanka College of Obstetricians kind of recommended the vaccination, and we started vaccinating our pregnant women very early onwards, somewhere around June last year. And we have seen a drastic difference with the vaccination with the people, the pregnant women who are getting severe disease is much less, and those who do get severe disease are most of the time are those who have not been vaccinated. So we basically always, when it comes to pregnancy, we always assess the risks as versus the benefits. So I think it's worthwhile exploring what are the benefits of the vaccine and what are the risks of the vaccine. So if I just touch upon the benefits, so we know that when you get the vaccine, the risk of developing severe disease is much less. And because severe disease can lead to the problems I mentioned before, by getting the vaccine you can prevent the risk of delivering your baby prematurely and all the risks which are associated with prematurity. And also it will reduce the risk of the mother staying in the ICU, going into the ICU, which can, like sometimes if a mother is in the ICU, she has to stay in the hospital for a longer period of time. So all that gets reduced through the vaccination. The other important thing is that when you get the vaccine, your immune system will produce some antibodies, and these antibodies are able to cross the placenta, so that when the baby is born, the baby is already coming with a certain degree of protection against COVID-19. Which is, I think, a very kind of useful thing. So this can happen with natural infection as well, but with the vaccine they will get a boost in their immunity as well. So the newborn baby is also coming protected.
Now that is very, very important information coming to you from Dr. Achintha Dissanayake. Now in medicine we always look at the risk benefit balance, and when you compare the benefits as opposed to risk involved with the vaccination, definitely especially considering the pregnant ladies, it's always better to go get your vaccinations, the boosters. Like Dr. Dissanayake said, after your second dose, if 3 months has lapsed, irrespective of the period of pregnancy that you are in, first, second or third trimester, you are eligible to get the boost, and that is what we recommend here on Healthline. Now to continue our conversation, sir, if a pregnant lady is positive with COVID-19 and if it is diagnosed by a PCR or rapid antigen, and there are several stages of pregnancy also, what are the treatment considerations that you would consider as obstetrician, and what are the treatment modalities available? Because we see certain pregnant women are treated at home, some are told to admit immediately, and in some cases immediate delivery is considered. So what are the treatment considerations?
So I think it's a very important question. It depends upon the individual person. But of course, recently there is a circular issued by the Minister of Health advising all pregnant women to admit to a hospital-based institution and or a COVID center, where they will be observed for 48 hours, and then they will be may be able to go home for home-based care. Again, it depends upon the severity of the symptoms, as well as how far they are in the gestation, as well as their vaccination status, as well as the other comorbidities they might be having. What we know is that women who are kind of elderly, especially above the age of 35 years, who are kind of obese and BMI is above 30, and also who have other medical comorbidities like diabetes, hypertension, they tend to have more complications with COVID, apart from that when they are pregnant. So as I said, majority will be having only mild symptoms or might be completely asymptomatic, and if they are fully vaccinated, sometimes they might be eligible for home-based care. In that situation, of course, it's very important that they are managed symptomatically. We don't give a lot of medications, but to control the fever is important, so we give paracetamol every 6 hourly, and it's important that they don't take antibiotics unnecessarily, because one thing is that this is a viral infection and antibiotics won't work against viral infections unless it's a bacterial infection. And also not to take over the counter medications, because certain medications might be actually harmful for the baby. So these are the treatment options for mild disease. In addition to that, we also advise them to have good hydration and maintain good nutrition while they're at home, as well as monitor their symptoms, especially their saturation levels as well as their symptoms. And if they do develop any worsening of the symptoms, they should be in close contact with their obstetrician, physician, as well as their antenatal clinic, which they are followed up under. And they should have a plan on how to admit, to which hospital they are going to admit to. So that's how home-based care will tend to carry out. But
that should be with the consultation of the obstetrician.
Yes, definitely with the consultation of the obstetrician, as well as the medical office of health in that area, because for community-based care, mainly the medical office of health in that area is responsible, along with the public health midwife. But again, it's very important to have a quick, good communication. And apart from that, there are a particular group of women who will have severe disease, and if they do have severe disease or while at home if their symptoms worsen, it is very important without delaying that they admit at the proper time. And in the hospital setting, of course, we give additional treatment methods for severe disease, which we know that there are certain methods which are known to improve the outcome. And especially one thing is steroids, and steroids helps for the baby's lungs to mature as well. Again, we do not advise them to take it when it is mild disease, because it is going to be more harmful when you use it in mild disease, but it's of course it has a place when it comes to severe disease. And there are other treatment modalities like tocilizumab, which is an interleukin 6 receptor antagonist, and also monoclonal antibodies are also there, and also we give oxygen. So if a patient, if a pregnant woman needs these, then of course they should be in a hospital setting. And all these treatment modalities help to improve the outcome. And of course we give in the hospital setting we give anticoagulants, because as I mentioned earlier, the risk of clot formation is much higher. So to reduce the risk of forming clots, we give anticoagulation. And especially women who are having COVID pneumonia, and especially who are in the latter half of the pregnancy, if the baby is mature enough to be delivered, we consider delivering as well, because delivery itself helps the pregnant woman to recruit most of her lungs, which had been scotched up because of the pregnancy, and that itself shows sometimes drastic improvements in women who have pneumonia. But again, we have to balance it against the risk of prematurity of the baby, as well as how severe the disease is in the mother. So it's a bit of a tricky decision. Best thing is not to go to that stage and prevent from getting the disease in the first place.
Definitely. Now, we have seen with regards to COVID-19, the non-pregnant community, the not so severe disease, the patients getting medicine over the counter. Some prescriptions are being circulated via WhatsApp, and some say this is what my doctor gave me, so it should work for you. But definitely for the pregnant ladies, that will not work, definitely, because certain medications are bad for your pregnancy, for the baby. So all that should be taken after consultation of your obstetrician. And like Dr. Dissanayake said, antibiotics in most cases in COVID-19 doesn't really have an impact because it's a viral disease. But of course, in certain cases, after the consultation of your obstetrician, they might use these antibiotics in certain cases. So our message to you is, if you're pregnant, if you're positive with COVID-19, make all the decisions in close consultation with your obstetrician. And like Dr. Dissanayake said, the Ministry of Health has issued a new circular where they recommend admission of all positive COVID-19 patients in pregnancy for 48 hours of admission. But of course, moving forward, these regulations might be subject to change. Now, continuing on with the discussion, sir, now if a pregnant lady is positive with COVID-19, we know that especially in the Sri Lankan setup, the delivery dates are pre-planned. Sometimes the cesarean sections are planned for a certain auspicious time, so on and so forth, or they want to go for a normal delivery. So if a patient is pregnant with and positive with COVID-19 and the delivery is imminent, can those pre-planned plans be executed, or will that be subject to change?
Yeah, so basically getting COVID-19 infection close to delivery is a bit of a tricky situation. Now, there are two aspects to think of. One is when they get a natural infection, the mother will start producing some antibodies. Now, these antibodies will transfer across to the baby, and as I said earlier, the baby will get a certain degree of protection. So if they do get COVID infection close to delivery, in some instances it might be better to delay the delivery until the infection settles. Having said that, there are some situations where we cannot wait until the infection settles, especially if the infection is getting more severe, and especially if the pregnant woman is having pneumonia and is already compromised and her oxygen levels are going down, especially if the baby is mature enough to come out and survive outside, then there is a chance that we might go for delivery. But again, delivery with the presence of COVID is quite tricky, because it has been proven worldwide that when you have COVID-19 infection and when you are in labor, the risks of cesarean section increases.
But can they go for normal delivery?
They can go for normal delivery. Normal delivery is quite possible, and there are several women who have achieved normal deliveries without any problem at all. But it is kind of it is more strenuous for the healthcare system, because you'll be wearing a personal protective equipment, and you'll be staying with the mother throughout, and and also sometimes we have to make, there are things can happen very fast when it comes to pregnancy and labor, and things can suddenly go wrong. So in cases of emergency with COVID-19, with the infection control measures in place, sometimes transferring from the labor room to theatre itself might have its own delays. So the team who is taking care of the mother should be geared and prepared to look into those matters and have a kind of a safe period, so that they can, in case there's an emergency or there's a problem, or if there's any drop in the baby's heart rate, they can quickly transfer to the theatre without any delays. So with all those measures in place, women can still deliver normal have normal vaginal deliveries, but it's just that you have to take those extra precautions. And the cesarean section rates are a little bit higher when you have COVID-19 infection in pregnancy, but that doesn't mean you can't deliver have a vaginal delivery. You can still have a vaginal delivery.
Right. So now, after delivering a baby in a COVID-19 positive mother, does the baby have to be separated from the mother? Can the mother breastfeed? Or these are questions that most of our women will have.
Yes. So again, a mother would be, of course, very anxious when she has COVID-19 infection. She would be worried that the baby will get it, but separating the baby from the mother will have more detrimental effects on the baby as well as the mother, especially that bonding period is very important. And to establish that mother-baby bond, it's very important that they breastfeed as well as the baby is with the mother. And it's very
sorry, just to interrupt. Does that have an increased risk of the baby getting the COVID-19 infection?
Well, as I said, with the first few variants, we experienced very small number of babies got COVID. So the risk of transmission was very low, and the small babies don't tend to get very severe disease, as from what we have seen so far. Of course, with the Delta variant, comparatively we saw a little bit higher number of babies getting affected. But again, the harm by separating the mother is more. So it's very important that the baby is with the mother, and also breastfeeding is very important. I think Sri Lanka has done really well with breastfeeding, and it's very important because even breastfeeding helps to transfer those antibodies to the baby to provide some protection as well.
Definitely. Now, talking about lactating women or breastfeeding mothers, are there any contraindications, or do we recommend this vaccination for breastfeeding mothers?
Yes, so even during breastfeeding, the lactating mothers are quite safe to get the vaccine. And at the moment, the vaccine which is given is the Pfizer vaccine. And Pfizer vaccine is one of the most studied vaccine when it comes to pregnant women. So the database from VSafe, which is the USA-based registry, where the vaccination started, has vaccinated almost 170,000 women. And no significant adverse effects have occurred. So it's quite safe to vaccinate during pregnancy as well as even during lactation.
Right. Now, when we talk about, since we touched upon the topic of mental health in postpartum women, we know even as a normal consequence without COVID-19, you mentioned that mothers are more prone to get postpartum blues, or sometimes postpartum depression. It might even go to a severe level like postpartum psychosis. You mentioned that getting COVID-19 increases this risk, and because they are isolated, they are separated from their support system. So what kind of preventive measures can we take to reduce those consequences of adverse mental health effects in these mothers?
Yeah, so I think it's a kind of thing that we tend to we focus on the COVID-19 infection, but we forget the mental health aspect, which has tremendous impact on the mother as well as the baby as well. So it's very important we address that as well. So it's very important to keep the mother in a the mother should be free to express her views. And also I think with the COVID-19 pandemic we have increasingly used telemedicine, so we are using our smartphones and we are using our telephones, and so it's important to establish that communication. Sometimes we can't communicate very freely with the mother because we are wearing our personal protective equipment, so the facial expressions can't be seen by the mother. So but it's important we can use video calls and all that, and it's very important that the family members also help with that support system, because usually when a child is born you get all the, in our culture you get all the family members coming, but now because of the COVID-19 pandemic we won't have that much of interaction, and also the mother won't feel that. So even if she has got COVID-19 and she delivers, it's very important that the other family members, through either probably video calls or probably through other methods, alternative methods, establish that connection. And of course it's important to empower that woman so that she can take care of the baby and also give her the necessary support, because it's very I mean, from the places I've worked in, Mullaria Hospital as well as KDU Hospital, so we have seen lots of support system from the patients themselves, and they themselves help each other as well as the staff, and sometimes it's just a matter of few words or like a few moments or 5 minutes of kind words will make a huge difference and will reduce these mental health issues.
Of course. Now pregnancy, the period of pregnancy itself is a period of high demand, high stress for a mother, and so if you get COVID-19, of course that will increase, and as her family, it's our duty to be the support system that she needs, maybe not in the traditional way that we are used to, but like Dr. Dissanayake said, maybe through video calls, a kind word can go a long way, because mental health with association to COVID-19 is often one aspect that is overlooked in this entire scenario. Now with the time constraints that we have, sir, we are coming towards the end of this episode. Before we wind up, what is your message to our viewers in this backdrop of Omicron rapidly transmitting around the country, and pregnant women being more prone to this disease? What is your message to our viewers?
So my final message would be, of course, be safe, and also practice the social hygiene measures like physical distancing, social distancing, avoid overcrowded places, especially if you have a pregnant woman at home. The rest of the household members also have to take the responsibility to be extra careful, and also wear masks when you are going out. So those are the routine measures that you have to take, and in addition to that, very important is that make sure that you get vaccinated, and especially don't forget the booster dose if you are 2-3 months since your last dose, and also you are eligible for the booster dose, and even after COVID-19 infection 1 month after you can get the vaccine. So get the vaccine. If you have any doubts or you might have any individual queries, of course don't hesitate to meet your obstetrician or your physician and get the necessary advice that you require.
Definitely. Now that was a very timely discussion, we feel, and that is why we thought of discussing about this COVID-19 infection in pregnancy. So we thank Dr. Achintha Dilshan very much. Thank you very much, sir, for joining us here on Healthline and educating our public. That was very valuable information, I'm sure, that they got from you. So thank you once again for joining us.
Thank you, Dilshan. Thanks.
So with that, we come to the end of this edition of Healthline. And like Dr. Dissanayake said, like we've been saying over and over again here on Healthline, COVID-19 is not by any means over. We still have to be careful, practice all the measures that we have been advocating time and time again, keep our community safe, keep our children safe, and especially our pregnant mothers safe. With that message, I take your leave from this edition of Healthline. Until we meet you again next week with your weekly dose of wellness, this is me, Dr. Dilshan Fernando, signing off, wishing all our viewers Ayubowan.